Hello and welcome to another vlog or video blog that we're running for County Equine. I'm currently in between visits, hence here I am in the car, and I decided I think to talk to you today about some of the additional therapies that we provide with horses to improve their mobility, comfort and performance. And today certainly I'm here at a local livery yard in Cornwall where we are offering checkups for horses looking at chiropractic acupuncture services. So for a lot of people they have an idea of what a chiropractor does, and certainly here in the UK really a lot of chiropractors are either McTimoney based or they have gone to a chiropractic school where they've either trained as a vet initially, or in my case that was what I did, or they may have actually done a human chiropractic training first and then done an animal conversion. So really, one definite thing I would say is check out the qualifications of the people coming out to you, because unfortunately we do hear of people professing to deal or do horses' backs, and we do hear from time to time quite unusual cases of discomfort and actual problems being created because of that. So certainly check out that, whether it be a soft tissue specialist, so somebody who does equine sports massage, physio, there's Bowen techniques, there are soft tissue myofascial release techniques as well, which can be used. So definitely take a look at what it might be that your horse needs, and certainly check out that qualification with the person that you are investigating and possibly having out to see your horse. The idea behind chiropractic in particular is that we aim to increase, as I say, mobility. In doing so we improve performance, and often as well in making sure that joints work a little bit more appropriately for that animal. Certainly if they've got an athletic function, then we can improve their comfort levels as well. So it's worthwhile again getting your professional who's coming out to actually describe what they are looking for and what they're doing, and what they should be able to tell you what they can find and how your horse should be improving as well. The idea behind chiropractic, as I'm getting to, is that we aim to try and improve mobility. So in a part of our examination we should be looking at horses moving. That's really, really important. Whilst we'll look at them in the stable, I generally have a feel over them, see if there's any problems or any history of any back or lameness issues. We'll then do a trot up and a walk up just to be able to see actually how that horse is moving at the time. And again, from our training we should be able to see exactly how they move, and we should be able to really try and explain to the rider what they should maybe be able to feel, and often I'm able to do that for them. Sometimes we'll see them being ridden, and obviously sometimes we'll see them being lunged as well, just to give us an idea for lateral flexion issues, whether there could be an issue there that's not been recognised, or again to exacerbate a behaviour that maybe the rider's already described to us. The chiropractic is on the whole a very well tolerated treatment. We work systematically through the joints of the body to see if there is any areas of restricted movement, and if so then we will do an adjustment through that. So a lot of people think of chiropractors as bone crackers. It's really quite a little bit more specific than that. Occasionally you do get a crack when we're straining a joint or adjusting through a joint, and that's just a cavitation or air within that joint pocket, so nothing really to be alarmed by. And that's equally, sometimes we never get that occur as well. The examination, as I say, is very systematic, so we can work through and see where joints are meant to be moving in their normal range of motion. So it's often, for example, an up to down or left to right direction, and if we're again finding that there's restriction there, trying to isolate why that might be, and if necessary treat, so either by doing soft tissue techniques or actually using the chiropractic to try and make those joints move a little bit better. Everything should be done within the normal range of motion of that joint. So if for some reason the things aren't moving well, certainly we might think, maybe more with my veterinary head on, is there something underlying this? Is there a reason why that might not be happening? But we don't force joints to go into positions they're not meant to be going in. So once we've done that kind of examination and treatment, that might be that we've diagnosed that there are soft tissue areas as well, and certainly as a vet I'm qualified to perform acupuncture, and acupuncture works in the same way as it would in people. We use specific points or locations of the body to try and stimulate certain areas and certain regions of the nervous system as well. And the idea again is to improve comfort in those areas particularly. That tends to be how I use it. Occasionally we use it for medical reasons as well, and the Chinese can tend to think of it as a yin and yang kind of situation, and what we'll aim to try and do is normalise the body's responses. So whether that's an overactive immune system, for example, if they've got sweet itch or an allergy,